very much. My name is Shauna. A few comments based on what other people have said. My mom has advanced Alzheimer's. She's at the Edmonton General, run by Covenant Health, and they have recommended she get a companion for meals. So not for outings and such, but for basic care. So an interesting detail is that she got a companion through Covenant Health. So her estate pays $20 an hour, $8 stays with Covenant Health, and $12 goes to the companion. For things that I would have expected Covenant Health to provide. Covenant Health, they're changing the staffing, and the staff are very concerned about bumping. And for sure there's all sorts of stories, but having been there yesterday, the staff were meeting with union and such, and their biggest concern is that bumping has to do with seniority. So the staff were saying that they got specially trained for this Alzheimer's unit, and that has nothing to do with who's going to be there. And the last time there was bumping, 10 of the 20 staff changed within a 1-month period. That's not good for anybody. And it's going to happen again. And it'd be very interesting what they say to you at your Thursday meeting. It's hard to understand how that's good. You had said, this was the question, you'd said that there are 24 ways to submit concerns. I've submitted concerns and actually been banned. Currently I am banned. I got everyone involved possible. The Ombudsman responded saying it's not been fair. The Auditor General's report that came out last month says the Ombudsman doesn't have any further authority. I spoke to the Seniors Advocate. He has no authority. So who in fact has authority to ensure, if the Ombudsman says it's not fair, but has no further authority, could you direct me to who would have authority if there's 24 ways to submit a concern? And sorry, just one other thing. The Seniors Advocate said, we accept all complaints, but we have no authority to do anything with it. Thank you very much. Thanks.
This feedback is always good so that we know next time that we explain when we make statements like that, but thanks for bringing that up. So when we were told there were 24 ways to bring a concern forward, that would be 24 ways in a variety of settings. So the ministry may have their concerns processed, which you've obviously experienced. The seniors ministry may have their concerns processed. Alberta Health Services will have their concerns processed. Covenant Health will have their concerns processed. Not done yet. And then facilities will have their own, so the operator may have their own concerns processed. And then on top of that, you may have advocacy groups, so the MS Society, the Alzheimer's Society, the Seniors Council on Aging. We found out there was an issues management portfolio in one of the ministries that just came to light. So you're right, there are many, 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 many avenues around how the concerns process. People can bring their concerns forward. And I agree that it is very confusing. So I'll let Isabel talk about the accountability.
But who can address it?
The accountability piece, yeah.
I think from the accountability perspective, because I did follow up on the ombudsman, and his role is really to basically identify whether due process has taken place.
And he ruled if the process didn't take place,
Okay.
but has no further authority to compel the facility. And I did go to the seniors ministry and the AHS and the health minister. I did all of that. It's been years. It took the ombudsman 3 years to investigate.
Yeah.
But I'm still banned.
That's terrible.
Banned from going to the general? Or
Banned from visiting my dad, and they will invoke the Trespass to Premise Act if I visit my mom for more than 1 hour. Or if I visit friends who've submitted requests that I visit. So it's not fair. It's been determined it's not fair, but there's nobody with any authority to compel them to correct wrongdoing.
I would
And
say-
based on, sorry.
I would say ultimately it's the CEO of Alberta Health Services for any, and Covenant, because that's a bit of a
Well, and the CEO was
complication.
involved with the ombudsman. So the ombudsman communicated with the CEO.
Okay.
So the CEO was aware of it's unfair.
And have you had a response from back from the CEO then?
She's been bad.
Just the ombudsman, other than the ombudsman, will investigate. So there's no follow-up. Like a letter saying it's not fair, and that's where it ends.
Okay.
So who has the authority to ensure correction of wrongdoing?
I would say it's the CEO of Alberta Health Services.
Or covenants.
Well, Covenant doesn't feel they've done wrong. I mean, it's been determined they've done wrong by the ombudsman, but Covenant Health has said they're independent of AHS.
They're independent of ages.
Yes, they are. Yeah.
So then, sending me through the AHS process doesn't make sense.
We'll have to do some more homework.
Thank you.
Get
Do some
your-
homework.
I did get your phone message and you did start to make some calls.
Thank you.
Yeah.
Thank you, Sean.
Thanks very much.